I've heard our work, our profession referred to as the best kept secret in American medicine. There are a lot of DOs around that are not known for being DOs. They may be a pediatrician, obstetrician, cardiologist, surgeon, emergency room doctor. DOs have integrated themselves throughout the medical system, and in varying degrees, the DO will use his or her hands. Some people may not realize that we've had a DO physician who's been personal physician to the President of the United States, which includes President Bush and President Obama. So DOs have been well accepted. In the past, we've had more opportunities for DOs to graduate and go into osteopathic residencies because of changes in our medical system. Those opportunities have been declining, and so there's less opportunity for the new physician to work side by side with a practicing DO that's using their hands, and for them to develop the confidence, to develop the skill. That's one of the reasons why we have this foundation, is to create those opportunities.
It's an unknown partly because not all DOs, doctors of osteopathic medicine in the United States, are practicing with their hands or practicing a traditional approach. There's a social and economic pressure by virtue of the dominant profession to practice in the way that MDs practice. So many DOs default to that and abandon this aspect that makes them different. It's also, in fairness, not an easy thing to learn. When I say it takes an average of 7 or 8 years to learn, until recently, there was not 7 or 8 years of training available before you started practice. Physicians went into practice after medical school in 1 or 2 or 3 years at the most. And if someone required 8 or 9 years to gather skill with their hands, enough to get better results than prescriptions and surgeries get, how are they supposed to practice? Also, skillful teaching is very hard to find. There are not that many people in this profession who have both the ability to perform this practice at a high level and get the results that someone would want to emulate, and also have the ability to talk about it. There aren't that many. It's not easy. It's not easy to discuss, to put into words this aspect of the use of our hands.
The time is coming now where we are starting to make inroads in terms of patient care. And with the changes coming down the road here that are being dictated by the government down to us, who are actually dealing and treating with the patients, we in the osteopathic profession are trying to put forth our best effort to show the research, to provide the evidence that this should be part of the standard of care for patient care. As we move forward with research and evidence starts to come out that the osteopathic approach and treatment modalities are very impactful and can change outcome measures, I think those are the things that become attention-catching items that when it's presented at conferences and physicians are made aware of impactful changes that osteopathic medicine can provide, that's when they start to look at it a lot closer. It's when the evidence is there. And that becomes important, clear across the board from training on up into postgraduate training and into practice. I mean, guidelines are what drive patient healthcare. And the guidelines are based on the research that's available, the best practice evidence. And those are the things that we need to look at strengthening from the osteopathic standpoint.